Here is your question. Right. So if you have read and understood, considering its surgical pathology station, kindly tell me what are the differential diagnoses that you will consider for this patient after listening to the patient's history or presenting
Ma'am,
complaint.
giant cell
Okay.
arteritis,
And
transient ischemic attack,
okay.
stroke,
Okay.
embolus or thrombus.
Okay. Right. Can you tell me what make you prioritize your differential diagnosis or provisional diagnosis like this?
As the patient is female,
Yes.
uh, older age group,
Elderly, yes. Female and elderly, yes.
and she has sudden onset of loss of vision.
Yes,
So probably some vascular involvement
could be there.
in the head. Yes, ma'am. Head
Okay,
and neck region.
can you please tell me what do you understand by the term joint cell arthritis?
It's a inflammatory pathology of the small and large vessels.
Okay, not large, small and medium, not small vessels, not large vessels, small and medium large and medium vessels, not small. I'm sorry, I'm myself getting mixed up. Okay, right. I- what are the investigations would you ask for to confirm your diagnosis?
I will like to do the blood investigations, ESR, liver function test, and
Yes.
also temporal artery biopsy.
In how many cases this temporal artery biopsy is confirmatory?
Only in 50% of the cases.
Okay. What should be done in the rest of the 50% cases when biopsy becomes false negative?
In those cases, it will be helpful to rule out other differentials,
Yes. Okay.
and
Can
we
you
can.
tell me what is the mechanism by which this joint cell arthritis spreads or yeah occurs?
There will be intimal in thickening, which causes the obliteration of the lumen, and there will be granulomatous inflammation of the internal elastic lamina, which results in disruption and fragmentation of the internal elastic lamina, along with the infiltration of uh, CD4 plus T lymphocytes and macrophages.
Okay. Can you tell me why there can be a transient loss of vision in this patient? Why she complains about it? Why can there be a transient loss of vision in this particular patient?
Uh, because of the involvement of ophthalmic artery.
Okay, good.
Hello, ma'am.
Yes, now I can hear you. Yes, that can be, and that can lead to ischemia or optic neuropathy. Right. Can you tell me how would you plan to manage this patient?
I will like to start the patient on corticosteroids
Yes.
methyl prednisolone IV or oral prednisolone 60 milligram for a
Yes.
period of 2 years.
All right. Considering the age of the patient also, you would have to, and if, okay, can you tell me what are the challenges that you have to keep in your mind considering the old age of the patient and the severity or the condition patient has while you're prescribing corticosteroids for a prolonged period of time?
Uh, there is a risk of developing complications,
Like,
and if she stops the steroid, there can be developing chance of developing into addiction crisis. Also, she is always high risk of possible
your voice has become muffled. I can't understand anything you're saying. Yes. What are the complications you said, please? Can you tell me how these steroids that you'll prescribe lead to the pathological changes in osteoporosis? What are the pathological changes that will take place or occur at
Hello,
bone
hello,
level?
ma'am.
Yes. At bone level, yes. What be the osteoporosis or the pathological changes that will take place or occur?
Ma'am, one more time, ma'am.
Sorry?
Please
Histologically,
repeat the question.
yes. What would be the pathological changes that you'll see in this patient in case if she develops osteoporosis? So how would she appear like histologically? What would be the at the level of the bone? What would you see or what would happen?
There will be thinning of the microarchitecture of the bone, loss
Okay.
of bone density,
Yes.
and the uh, loss of trabeculations
Yes.
of the bone will be there
Yes.
because of increased osteoclastic resorption,
Yes. This will lead
and
to, yes,
this will lead to development of fragility fractures.
pathological fractures as well. Okay.
Yes.
Can you name few other conditions that can also lead to pathological fractures?
Can be neoplastic or non-neoplastic. Neoplastic include multiple myeloma and metastasis, and non-neoplastic include vitamin D deficiency, osteomalacia,
Very good.
Pegas disease, osteogenesis imperfecta.
Okay. Can you please tell me if once you have done the biopsy and it comes out positive, what would you see? What are the features that you'll see on the biopsy which will confirm the diagnosis?
There will be intimal thickening
Yes.
and disruption of the internal elastic lamina, and
Yes.
presence of granulomatous inflammation with the CD4 plus T lymphocyte infiltration and macrophage infiltration, and giant cells in around 75% of cases.
Very good. Okay. Just suppose this particular patient, this particular old lady comes back to you after 1 year and she's unable to walk. What would be the most likely diagnosis you'll think of?
Avascular necrosis and pathology.
Yes, very good. Avascular necrosis or osteoporosis because of neck of femur fracture. All right. How
Yes.
would you manage that at that?
Uh, she she would need a hip replacement surgery if
Yes, very
that
good.
is.
Considering, yeah, old age and everything. Okay. Can you tell me, right, what are the other side effects of Bellascon, but what are the other side effects of steroids that you should also watch out for?
She can develop Cushing's features,
Very good.
diabetes mellitus,
Yes.
cardiomyopathy,
Yes. Very good.
uh,
And
and muscle weakness,
okay.
also
How?
depression,
Yes. Yes. You are coming there.
and mm,
What
I
happens
forgot.
when there could be mood swings, water retention,
Yes, ma'am.
swelling. There could be weight gain, there could be increased appetite, blurred vision. So one blurred vision or transient loss of vision is because of her condition that she's going through, and one blurred vision could be because of use of the steroids. These are one of the unwanted side effects of the steroids. So
Okay.
losing in glaucoma could also be there. So worsening of the eye symptoms or eye condition could be there. So this is one thing that you should watch out for. But if
Okay.
she stops or interrupts or does not take steroids regularly or the medications regularly, what would happen?
She will develop Addisonian crisis.
Yes, very good. Right. Okay. This is the primary cause, one of the primary cause of osteoporosis. What could be the secondary causes of osteoporosis in adults? Not necessarily in her, but in adults.
Secondary causes can be because of hypothyroidism
Okay,
or hyperparathyroidism
very good.
or
Yes,
hypothyroidism,
yes,
vitamin D deficiency,
yes,
and, uh, because of intake of anticoagulants,
very good. Because of, yes, medications, yes. All right,
and
good.
then senile osteoporosis, postmenopausal, and idiopathic.
Right. So when this patient comes back, I said after 1 year and she was unable to walk, you suggested that you'll operate on her, and she is already taking steroids. How would you prepare her for surgery, or what would you consider before preparing her for the surgery?
Considering the risk of developing Addison crisis,
Yes,
I will increase the dose of steroids and I will
very good. Yes.
shift the
This
patient to IV hydrocortisone.
Yes, very good. This was what I wanted to hear. Very good, excellent. This was superb. Thank you so much.
Thank you.